today's video we'll be discussing robotic surgery tools. So the first thing I'd like to talk about is what are they? Despite their name, robotic tools are not autonomous decision-making tools. Instead, they're requiring significant input from the operator. Basically what that means is that a lot of the surgeons and people who operate these machines, actually it requires a lot of training and manipulation to actually learn how to operate these machines. And it's not something that can just be done, and it's not something that's like an autonomous machine that actually makes all the decisions for you. It's just kind of like an aid for a surgeon to use to make it work. Some examples of these are the Da Vinci surgical system, which is a robotic surgical system made by the American company Intuitive, and it's a minimally invasive approach, which means it's trying to not hurt you as much as possible, and it's most used for prostatectomies, and to repair the heart and stuff like that, and for gynecological surgical procedures. Basically it's just something that's it's another example of a robotic surgery tool, and this is the Da Vinci one right over here. And then the cyberknife radiotherapy is just something that's used for trying to help with cancer research. Okay, and some of the pros of robotic surgery is that basically it's supposed to reduce pain, which, I mean, if you want to not have a lot of pain while you're getting surgery, then why not? And then there's a very small chance of error, because there's really never been so many errors that have ever happened. And since the thing is there's so much procedure and training that goes into someone learning how to use these, that and it's they're not meant for really super complicated procedures, but ones that can be done fairly simply. So it's just something that can be considered. The cons, if an error occurs, no one really knows who's at fault, because there really hasn't been any major errors that cause people. Is it the robot's fault? Is it the main, the doctor? And the main con is it's really expensive. Alright, thank you. In this video, we will be talking about patient simulators. The first thing I'd like to talk about is what they are. They basically are just simulations of a human. I know that sounds really frank and brief, but that's pretty much what they are. They can mimic a lot of different things about the human body, such as heart, body temperature, and all these different things, so that students can use to practice on not a live person, but they can use it on someone that can't die, so to speak. Okay. And then these are just some companies that make them. The leader being Laderall, and then you have Godmard, CA Health, Brand Health, and NCABI. And what are they used for? Patient simulators are really used for basically to greatly improve the realism of medical training, enabling doctors to see realistic responses to their actions in a safe environment with no risk to real patients. The doctor skills can also be assessed with the simulator, automatically recording factors such as the actions taken and how well they were applied. For example, whether the correct amount of pressure was applied to the chest during CPR. Of course, with all these simulations, the results never match real life completely. So those are some pros and those are some cons. Obviously, It's not going to be exactly like real life, but it's as close as you're going to get. But it's a safe bet because it's safer than allowing like a new doctor to just like kind of figure it out on his own, who could die as a result of it. And all my sources come from Information Technology and Global Society for Stu Ray, and that's for both of the videos. Thank you.